44-year-old Samuel Baker was a normal and healthy father of two. Samuel works in a factory-like setting manufacturing steel sheets. He is a regular smoker, smoking about 1 to 3 cigarettes a day. 4 weeks ago, he developed a cough. He had thought nothing of it as this was a common occurrence after smoking a cigarette. 3 days later, he began to have night sweats and would regularly lose his appetite. He had a small tingle in his chest when the coughing started. However, after 2 weeks' time, it became almost unbearable. He had managed to lose 5 pounds in a 2-week period and became weaker and weaker by the day. His doctor had given him common cold medicine, however, it was ineffective. One day while working at the factory, his coughing suddenly became more severe. He was sat down by his coworkers and given a short rest. He described his pain to his coworkers in his chest. Eventually he began coughing up blood and was promptly rushed to the hospital. Diagnosis: tuberculosis. Tuberculosis is an infectious disease usually caused by Mycobacterium tuberculosis bacteria. It generally affects the lungs, but it can also affect other parts of the body such as the kidneys, spine, or brain. The disease erodes at the walls of your lungs, eventually destroying them and flooding the lungs with blood. The main cause of the transfer of tuberculosis is through tiny droplets of water in the air from sneezing, coughing, breathing, etc. It can be transmitted through kissing and saliva, but only if the TB is active. A healthy immune system is usually strong enough to fight off TB, however, if it is weakened, a TB infection can grow. If a person has an HIV or an STD, the rate of infection can increase drastically. Alcohol use disorder and tobacco smoking increases the risk of TB by a factor of about 3.3 and 1.6 respectively. Some of the symptoms of tuberculosis is a chronic cough that lasts 3 weeks or more, blood containing mucus, fever, night sweats, and weight loss. Doctors usually do a tuberculin skin test to find latent TB. It consists of injecting TB antigens into a point on your skin, and if you have TB bacteria in your body, within 2 days you'll get a red lump where a needle is injected. Doctors will do a test sample of the mucus from your lungs to find active tuberculosis. Doctors might also do other tests on the sputum and blood, or take a chest x-ray. An expulmonary tuberculosis, which is where the tuberculosis is spread outside the lungs, doctors can take a sample of tissue test, or you could get a CT scan or an MRI. Many tuberculosis strains resist drugs commonly used to treat the disease. People infected with tuberculosis have to take many kinds of medications to get rid of the disease. It is most commonly treated with a combination of antibacterial medication for a period of 6 to 12 months. The most common treatment is isoniazid, INH, in combination with rifampin, pyrazinamide, and ethambutol. If the drugs are taken incorrectly, the tuberculosis bacteria may become resistant, and thus more medication must be taken or a different treatment method must be applied. An antibiotic called fluoroquinolones and injectable medications such as amikin or capreomycin are used if the tuberculosis becomes resistant.